All right, we'll move to our third speaker, Dr. Anggraini Alam from Padjadjaran University, and she will present about markers of dengue-related severity and mortality. Please, Dr. Anggraini.
Thank you, Prof. Adi. I hope my voice quite clear.
Very clear.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, good evening, good morning to Professor, Doctor, and our colleague. First of all, I thank to the committee to invite me to join this meeting. And right now, I will show you the diagram that dengue is a dynamic disease. From majority of dengue is mild disease, but 20% of them are with warning signs. And from dengue, 20 to 30% will be goes to the severe one, and 5% of all dengue will happen the severe plasma leakage, severe hemorrhage, and also severe organ impairment that lead to death 20 to 50% if the management not proper. So today, I want to present about markers of dengue-related severity and mortality. And this is my outline. So dengue clinical spectrum is quite wide, from mild to severe, and no specific treatment, and also limited for a vaccine right now. Unfortunately, there's no reliable routine laboratory biomarker that show us which one that can predict the severity of dengue infection or monitor the effectiveness of fluid management. So early prediction of dengue severity, we hope it will be reduced the fatality rate. And identification of reliable biomarkers or predictors is crucial in dengue. Clinicians, of course, increasing focus on understanding the pathogenesis of dengue. We know there are several perspectives: release of cytokines and chemokines, enhancement of viral replication, autophagy in endothelial cell, autoimmune disorder, release of course, the cytokines, apoptosis of T cell, enhancement of viral replication again, and increasing viral virulence can support the endothelial cell dysfunction and development of coagulation disorder. Due to the lack of an animal model in dengue, numerous studies focus to identify parameter or marker of dengue-related severity and mortality. So we need to predict the risk or outcome of dengue in dengue patient population. And these markers, of course, without the involvement of therapy. This schematic show us the promises biomarker to predict progression of severe dengue. Prior efforts to find out the identify molecular biomarkers for dengue severity are from 20 gene set, focused primarily on transcriptomic, that measuring RNA gene from blood, human blood, or PBMC, or from primary cell that infected by dengue virus. So this is cohort studies within 7 countries to know whether the dengue patient will become a severe one. And it showed that from 59 genes, they identified a set of 20 genes that optimize for prognostic to dengue to severe one. And these 20 genes are set strongly associated with the ROC. We see that the ROC, while the 20 gene set use 20,009 WHO criteria, the ROC will be 0, 18, 9, and this curve will be better if we use 1997 criteria of WHO. This 20 gene set predicts the progression to a severe one with a very high sensitivity, near 100%, and specificity around more than 75%. And this is the metabolic candidate biomarkers of dengue severity. And there are 20 metabolites differently enriched in dengue serum. And 2 of them, serotonin and kynurenine, seems promising for biomarkers candidate of dengue severity. Later, we will focus to serotonin because it cross-link with platelet and also surface adhesion of protein and clotting factor. This is the serotonin as the biomarker with the area under curve 0.8. But while serotonin combined with interferon gamma, the area under curve increased to 0.92. So to improve the serotonin predictive ability, it's better to use combination with interferon gamma. So this serotonin is the promising metabolite or cytokine instead of other 26 other chemokines or metabolites. And how about the apoptotic one as a candidate of biomarkers of dengue severity? The apoptotic microvascular is very important, play a role in vascular permeability. This circulating plasma cell-free or cfDNA, which is used in cancer patient, now being used in dengue because it released into the extra cellular fluid by various cells while the cell death that happened in dengue. Apoptosis being the major source of cfDNA in bloodstream, and it shows in various tissue in dengue with fatal cases. So it suggests the involvement of apoptosis that indirect shown by cfDNA in severe dengue pathogenesis. And this slide show that cfDNA will elevate it within 6 to 48 hours before dengue patient in the phase of effervescence or in the convalescent phase. And it will be elevated, of course, in severe one. And this show that the sensitivity of cfDNA around 87.5%, but the specificity rather low with area under curve 0.72. And this slide shows that the anti-dengue antibodies also as candidate predictive biomarkers. The theory of ADE, of course, this is very interested in, and this is the pathogenesis of severe dengue. And this study that showed anti-dengue binding antibodies correlated with dengue disease severity enrolled more than 80,000 children 2 to 14 years old for a long time, 12 years. So the pre-existing dengue antibody level may be used as a candidate biomarker for disease severity. Here the diagram. The highest hazard ratio that show this in patient with 1 and 21 and the titer 1 and 80. In children with higher titer or higher antibody levels, the hazard ratio of dengue plus warning sign or severe dengue or hospitalized patient showed less than those with titer 120 to 180. We can show that. So we estimated that the hazard ratio hospitalization also in 120 to 180. But while or when the patient have a high titer, it seems protective to be or the patient will be warning sign or severe dengue or hospitalized. So it's very interesting because this study showed the exact level of dengue antibody titers in patient with previous dengue infection. Inflammatory factors also candidate as biomarkers for severe dengue. More than 700 papers reveal that elevation of interleukin, especially IL-10 and interferon gamma in early course of disease are potential predictive biomarkers to severe dengue, including natural kill and T-cell population and expression level of surface. This is cytokine that showed in 3 phases of dengue. You can see this is the fever day. The cytokine will increase after the viremia decrease, and of course, as Dr. Ida said before, that studies show a different result of corticosteroid use in dengue, because this happened just in a very short time. In dengue, we have 3 phases, and also in COVID-19. But the timeline between dengue and COVID-19 are very different. In dengue, the critical phase just within 48 hours. But in COVID-19, the critical phase in the second week of natural history of disease. So we can see those cytokines in dengue, and it's correlate with the phase of dengue. Endothelial activation factors. This is very important in dengue, and it could be also as a candidate for biomarkers of severe dengue. A study in Colombia showed that 19 serum biomarkers checked by ELISA, such as ICAM1, endocrine, and chemokine, it showed that all of the endothelial activation biomarkers increase in severe dengue. So after all candidates of biomarkers, which prognosis assay for our dengue patients? So we have to know or translate the many candidates of biomarkers. Is there have a great sensitivity, specificity, accurate or not, and have a high predictive value? Is it safe and easy to measure and have a fast turnaround time? And is that cost efficient to follow up? Is it modifiable with treatment and consistent across gender and ethnic group? So it can be used in triage, fever, and can be defined in all level of care. So how to use markers of dengue-related severity and mortality in clinical setting, especially in limited resource, because we know it is not easy to use all of biomarkers that I explained previously. This is the change of lactate and fluid intake among severe and non-severe disease. It seems that plasma leakage resulting increase of microvascular permeability and leads to increased hematocrit level and or clinical fluid accumulation, impair the microvascular perfusion. Of course, it will increase lactate level, especially in shock or with dengue with organ involvement. So the peripheral venous lactate more than 2.5 have a sensitivity 65% and specificity 96.2%, and it will it higher in severe dengue, especially in the first 2 to 3 days of hospitalization. Combined with other biomarker, it will be increase the sensitivity and specificity to identifying severe dengue. How about the CRP level? Almost all hospitals can check the CRP level. This is a study, a large case control study, enrolled 8,000 participants from 8 countries, Asia and Latin America, has shown the increase of CRP level in the 3 days of hospitalization. The higher CRP, it seems happen in the severe dengue. So it means especially in children, if we check CRP while the children admitted to hospital, it could be predict that our patient will be the severe one. How about in adults? The higher CRP seems associated with hospitalization and also increase the longer time of fever, especially in adult, of course. And this is show that hematological parameter is very cheap, and of course we have to check a complete blood count in dengue. It showed that hemoglobin in dengue compared with non-dengue patient with acute febrile illness showed higher in dengue. And how about the platelet? Of course, it will decrease compared with other acute febrile illness. And also the white blood count that decrease before the platelet decrease. And leukocytes count, it's very important to our friend in the first line office. The leukocytes count, it's very important in dengue. We can see that the neutrophil lower than other febrile illness, but the lymphocyte showed very high, with the atypical lymphocyte will be defined as a blue lymphocyte in 5 days and later course of disease. And also monocyte higher than other febrile illness. So this is very important and very easy for our frontliner to differentiate dengue with other febrile illness. Another issue in the pandemic era, it is not easy to differentiate dengue with COVID-19, and 22% of COVID-19 infection may be falsely identified as dengue. Of course, we have to check PCR, but here in Indonesia, there's no PCR test for dengue, instead just for study or study situation. Because of pathophysiological similarities between DHF or dengue and COVID-19, plasma leakage, thrombocytopenia, coagulopathy will be happen, but we have to be careful. Both of them have 3 phases, but dengue, the 3 phase dengue, just within a week. In COVID-19, it will be longer, and the critical COVID-19 will be happen in the second week. So we see the coagulopathy. Both dengue and SARS-CoV-2 will significantly have higher D-dimer, both of them. And higher D-dimer in dengue compare dengue hemorrhagic fever and dengue fever. The high D-dimer level have sensitivity and specificity around 90% and 67%. And D-dimer also correlate with dengue severity in all stage of disease of dengue or all phase of dengue. So D-dimer will be increased in febrile, critical, and convalescent phase. It's the same with COVID-19. But although there's the same pathway, coagulopathy, but the result for dengue is a DIC issue or problem. In COVID-19, coagulopathy will be happen, the D-dimer will increase with the issue of hypercoagulable. So that's different between dengue and COVID-19, although the pathophysiology, maybe they have shared the similarity. This is the ferritin level in dengue and COVID-19. Because of many studies about COVID-19, it's very often clinicians check the ferritin levels. And in COVID-19, the higher ferritin levels means the increase of severity of disease. And also in dengue. In severe dengue, the ferritin as an acute phase reactant also will be increased. And it is not, it's common because it's produced by monocyte, macrophage, and also hepatic cells. And in dengue, the high level of ferritin associated with severe manifestation because of cytokine storm in pathophysiology of dengue. But in COVID-19, the ferritin will increase not only because of inflammation, but also because of direct cellular damage of cell and organ, especially if the ferritin level in COVID-19 over 600. So both of disease, dengue and COVID-19, have the same high level of ferritin, but the pathogenesis, but they do not share the pathogenesis. So this is my conclusion. There's many potential markers for dengue, maybe more than 50, and several candidate biomarkers may predictive the dengue progression to severe one in the early of disease. But currently, there's no laboratory biomarker to predict the severity in the market. And also, we need more diversity in study, including sex, including race, and also age. And in dengue, it needs to follow, to monitor the patient day by day, because it could be change in biomarker levels. So we need to check it day by day to evaluate the patient condition. And I show you the similarity biomarkers in dengue and COVID-19. But maybe it is not share the same pathogenesis. Thank you. That's all my presentation. And this is Moderator in Ciwidey, West Java. I hope you all can come to West Java after the pandemic situation.